I can't hear you. Welcome back. My name is Melissa Moritz. I'm the CEO of the ENT Institute. Ears, noses, and your throats. And today, welcome to the most unboring health podcast in the universe. And why? Because healthcare doesn't need to be boring, but it needs to get you better faster. So today, we are going to be hearing from Dr. Sheila Pack. What an incredible woman. She will tell you she is all geeked up about your hearing. What? Did you hear that? So, why is hearing so important and what can we do about it? I mean, it's one of your 5 senses. And out of all of your senses, you can actually do something to improve this one. So enjoy. Enjoy our show and come back for more.
Welcome, everyone. I'm Dr. Sheila Pack, and I am a doctor of audiology as well as CEO of the Hearing Center at the ENT Institute here in Atlanta. And this is, in all transparency, my first podcast, so bear with me. I was asked to talk a little bit about some of the changes we've seen in the hearing industry, in particular over the last year. And I think the buzzword right now in our industry is OTC. And for those of you who don't know what OTC stands for, that's over the counter. And in this case, over the counter hearing aids. So I thought today I would give you some information on what's available out there and my 2 cents as a professional on what I'm seeing and in the industry. So let's get started. Basically, in October of 2022, we started seeing over-the-counter hearing aids hit the market, whether it was in drugstores or online. That's what we were seeing. And as professionals, we all had we do have our concerns as to what this means for the people using the devices, for the hearing impaired population in general, and for the industry. So I thought, let's just get started on the difference. So basically, when the FDA cleared OTC, or they approved it, they developed 2 categories now of hearing aids. We have the over-the-counter category and we have prescription devices. So in my mind, it's very similar to reading glasses and what happened with reading glasses. I mean, I have both. I have reading glasses and I have prescription glasses, and they each have, they serve 2 different purposes. So I like to think of that analogy. But basically, I kind of digress. Over-the-counter devices, what's the difference? I think the biggest difference is one is more of a self-fitting device, and the other does require a prescription from a professional, from a hearing professional. And with the self-fitting devices, meaning you can go online or in the store, purchase these hearing aids, and they are called hearing aids. Purchase the hearing aids. You do not need to have a hearing exam, and you're in total control of adjusting these devices. Now, pros and cons to that, right? But basically, you purchase them, you take them home, you are adjusting the volume based on a self-perceived hearing loss. So you're in charge. And that's an over-the-counter. What we're finding is some of the things with over-the-counter, and I'm probably getting ahead of myself right now, but basically with over-the-counter, there can be a bit of a buyer beware, because every state has a different return policy. They're still working on some of this. As far as help with the devices, you're really not getting any of that whether you buy it online or you buy it in one of your local drugstores, there's no one there that can answer your questions and help you if you run into trouble with the device. Whereas with a prescription device, you're starting out with a hearing care professional. You were having a hearing test to determine, is there hearing loss in general, and is it the type of hearing loss that can even benefit from hearing aids? Because, your hearing loss could be simply due to impacted wax, which then we just remove it and you go on your merry way. So I think that in my mind, the importance of whether it's OTC or it's a prescription device, regardless of that, I think that my advice to anyone is first determine, is there actually hearing loss and what's causing it? And that starts with a hearing care professional. And in most cases, your hearing care professional is then also, they're going to guide you and they're going to tell you, yes, an over-the-counter device could be very appropriate for you. For example, you have a very mild loss. You're fairly skilled at working an app because that's how you control these hearing aids. And you're fairly independent in taking control of those types of things. OTC could be a great option for you. There are other people that you've got more significant hearing loss. There are medical reasons for your hearing loss that we need to work with. You have other medical reasons why you need hearing aids. Those are some very valid reasons why you would want to see your professional, stay with your professional, and be fit with prescriptive devices. So, I can go on. There's a list a mile long of reasons, why an OTC might not be effective for you. And we'll probably get to that in a later segment. That could be one on its own. But basically, over-the-counter prescription devices, two different animals. But in my opinion, it all starts with a hearing exam. So thank you for listening to my very first podcast on the differences between over-the-counter and prescription devices. I really appreciate any input or feedback you have. If you want to see more of this, please, comment below, let me know. If you want to hear about something else, I would be happy to tackle it, especially since I got this first one off the books, and now I'm a little less nervous. But join me next time, and I think next topic I'm going to address who really should not be looking into over-the-counter devices. And I think you read it all over the place. There's a lot of information out there about it. But I have one population in general that you're probably not aware of. So stay tuned, guys. Thanks.
What did Sheila say? Well, we hope you've had some great information all about hearing today, and you've enjoyed the podcast. I hope you will listen in on many more.